Worldwide, millions of people have dementia, affecting their lives and those of their caregivers. What is dementia? Dementia refers to a group of symptoms related to memory loss and a decline in thinking skills. The most common form of dementia is Alzheimer's disease. According to the CDC, in the United States alone, in 2020, as many as 5.8 million people had Alzheimer's disease. Globally, more than 55 million people live with dementia. Is dementia genetic? Most cases of dementia are not inherited. Only a small fraction, with rare types, have a strong genetic link. How do doctors diagnose dementia? Doctors will evaluate thinking, memory, problem-solving, language, and math skills. They also assess balance, sensory response, and reflexes using cognitive tests. Scans like MRIs or PET scans help check for brain shrinkage, called atrophy, especially in areas like the hippocampus, which is important for memory. Advances in AI now help measure these areas more accurately. A more invasive test involves taking a sample of the fluid around the brain and spinal cord, called CSF, to check for specific proteins linked to the disease, such as tau and amyloid proteins. Blood tests for dementia are also being researched, but more progress is needed. A psychiatric evaluation may be necessary if there are mood and personality changes to rule out depression. Who can diagnose dementia? Visiting a primary care doctor is often the first step for people experiencing changes in thinking, movement, or behavior. Neurologists, who specialize in disorders of the brain and nervous system, are often consulted to diagnose dementia. Geriatric psychiatrists, neuropsychologists, and geriatricians may also be able to diagnose dementia. Your primary care doctor can help you find a specialist. Are there ways to reduce the risk of dementia? There are many risk factors for developing dementia, and the most important one is age. Just getting older is a risk factor for developing dementia. However, there are modifiable risk factors: obesity, hypertension, diabetes, smoking, physical inactivity, loneliness, brain injury. Recent research points to neuroinflammation and ways to reduce inflammatory markers in the body that could help protect the brain. Many of the risk factors mentioned are linked to reducing stress and inflammation in the body. When should someone get tested for dementia? There are no clear guidelines for screening for dementia so far. However, researchers and experts agree that the earlier the diagnosis, the better, because treatments are most effective early on. We still do not have treatments that stop or reverse dementia, but there are medications that can significantly impact symptoms if administered early. Plus, early diagnosis helps patients and their families plan their lives before symptoms become severe. There is a lot of ongoing research in the field of dementia. We sometimes think that memory loss as we age is normal, but it is not. There is a pathological process in the brain leading to the loss of neurons, shrinkage of brain regions, and loss of memory and cognitive functions. It is exciting that more research and tools are available now for earlier diagnosis, and new medications and options that could help delay the progression of the disease, keeping loved ones with their families longer. I hope this video was informative. Thank you, and as always, stay informed and stay healthy.